A very good afternoon to everybody. I feel sorry that I'm being a barrier between you and the delicious lunch that is standing outside. So I'll try to shorten my presentation to the maximum that I can. So please pardon me for that. So I'm the Regional Director of the Middle East region for AAPC. I hope that many of you all must have already heard of AAPC. I'm referring to the students at the back because we don't see much of action coming from that side, as Mr. Sabu just said. So, okay, I'll just start off with my presentation. We've heard a lot many speakers out here who were discussing about indicators. So I was thinking that first let me just brief you as to what are indicators. So here we go. Now, every step that we take in life, it's an indicator that we want to move ahead. The fact that I'm standing here in front of you is also an indicator that for the next 15 to 20 minutes of your time, I'm definitely going to share some knowledge with you, not bore you. And of course, this is something, it's on a topic which is very critical these days in global discussions. So I guess the picture on the slide shows a lot about what we are going to talk here. And instantly, instead of throwing 1,000 words at you, you have already got a glimpse that an indicator points to something which is going to occur. I literally don't mean that a storm is coming on its way. So definitely looking at that, you must have got an indication by now. So with the goal of good health, we may think of an indicator as a measure that helps to quantify the achievement of a goal. So is a measure an indicator, or are they different? A simple example, a carpenter wants to know that the size of the table measures 2 meters by 1 meter. There are some metrics out there in the market, and we all know what is the size of the table. But if a restaurant owner has to measure the table, he will be thinking about a table which can help 6 people to be seated. He will speak about the seating arrangements of the table. So that is an indicator. It indicates the size of the table, 6 persons on the table, but it does not measure it in literal sense. So remember, you do not need to always make decisions with measurements. You can use indicators. I know that my car is dirty. I don't need a dirt measure to measure how much dirt is there. I know my lawn needs cutting, but I don't need a ruler to measure how big my lawn is, correct? So we know about indicators, what they can do. Now, this is a session where I would be stressing on health indicators, since we are talking about health out here, and that is basically to keep proximity to the agenda. Now, how many of y'all know who she is? Any nurses out here? Yes, who is she? Yes, she's the lady with the lamp, Florence Nightingale. So in the mid-1800s, during the Crimean War, a group of nurses thought of changing the sanitary conditions. They thought of improving the sanitary conditions of the British-based hospitals. So one among them was a social reformer and a statistician. She hailed from a very wealthy family, but convincingly enough, she was attracted to managing the poor, to helping the poor and the ill. She was none other than Florence Nightingale. So what she did was she kept the trends of the causes of death, and thereafter thereafter they programmed their treatments in accordance with the trends that she maintained and reduced the number of deaths that could happen in British-based hospitals. So basically, it started from there, the trending. The WHO, we've been speaking a lot about the World Health Organization out here. Now, the WHO, it defines health as a holistic, it defines health holistically. It's basically the state of being, a state of complete physical, social, and mental well-being. It does not only mean that you have a disease or an impairment or infirmity. Now, based on that definition, we can divide indicators into two broad categories. The health status indicators, it measures the different aspects of the health. For example, we speak about life expectancies, we speak about mortalities these days, we speak about how many people are having chronic diseases. And we also have the second category, that is the health determinant indicators, which basically measures the things that influence health. What is your per capita income? What is your diet? Do you smoke? Etc. So these are all influencing health. Okay, so I thought that I will be speaking during the lunchtime when you all will be having an aversion towards me, so I thought of bringing something flashy and cartoonish out here. Now, we are speaking about Mrs. Fitfat out here, a very common issue among many people, obesity, especially if you grow above the age of 40. So I'm not speaking about, I'm not literally saying that people below 40 are not obese. Yes, but this is something which we need to measure and we need to contain. So Mrs. Fitfat, now we've heard of many terms out there, lagging indicators, we know about leading indicators, we hear about baselines, benchmarking, targets, etc. So this example will give you a little bit of a definition of what all these terms mean. Let's say Mrs. Fitfat wants to lose all that weight and look beautiful and younger at the end of the year. So her actual weight is her lagging indicator. It indicates her past success. And now the number of calories that she consumes per day, it's her leading indicator. It predicts her future success. Now if Mrs. Fitfat, if she weighs 113 kgs today, so that is a type of an historical trend, and we can even conclude that as a baseline. Now she wants to look slimmer. She wants to emulate herself to someone who weighs 84 kgs. Now this is a type of a benchmarking, which we call. And then she'll set up her regime, and she'll want to weigh around 1,700 calories. She'll want to intake around 1,700 calories per day, and that is her target. I hope this definition gets into you a little bit. Okay, so just a small version of a joke out here, where a businessman, he enters a bar, and he orders, he asks the bartender to give him a double scotch whiskey. The bartender provides him the same. After having it, what he does, he looks into his pocket, and then he says, another double scotch whiskey. The bartender again gives him the second one. Then he goes for the third. Now, on the fourth one, the bartender wanted to ask him, what are you looking at inside your pocket? So the businessman just replies, well, it's my wife's photograph. The moment she looks good, I know it's time to go home. It's an indication. So the term indicator is derived from the Latin term indicare, which means to announce, to point at something. So indicators are used in various works of life and processes. And depending upon their environment, they've been defined in various different ways. Now, health indicators, they are meaningful to health. They are based in conceptual models for what influences health. Now, for example, if I say, in 1900, the leading cause for death was pneumonia, tuberculosis, diarrhea, etc. And now what is it? It's more of stroke, cancer, chronic diseases, etc. So who needs indicators? All of us do. And why do we need them? The government needs them for monitoring the health of the nation, setting health policies. The regulators for protecting patient safety and welfare, ensuring broader consumer protection, and ensuring market functionality, whether it's efficient or not. The payers need them for ensuring that the money is being spent effectively and efficiently and in line with expectations. You have the providers who need indicators for monitoring and improving existing services and even for benchmarking with their peers. You have physicians, again, staying up to date with current practices and being able to improve their performance. And then patients who can make a choice, a decision as to which hospital should I go to, where do they provide the best care possible. And finally, the public being reassured that the appropriate services will be available in the future as well. Now I want to switch gears and discuss some uses of health indicators. They can help us understand a system or a process. They can help us to compare it and even improve the processes. Indicators, they track changes over time. They provide evidence to support programs and policies. They assess whether or not the goals or the results are achieved, as well as identify gaps in health and health services for a particular population, and even they help in demonstrating the success of a program. So, the necessity of indicators. Now, the healthcare industry in recent years have been facing many challenges. In different countries, you have different issues which are coming. I've been hearing many questions on the financial aspect in India, but other countries face other issues, maybe on privacy, maybe on security, and maybe on culture, diversification, etc. So every country has their own issues. Now, speaking about indicators, the main reason is, for having indicators is basically a disparity in clinical documentation, in revenue generation, patient care, and even patient satisfaction for that matter. So some of the key reasons behind the necessity of building up the requirement of indicators in the industry. One is lack of documentation, affecting the approach as to how major illnesses are treated in most healthcare systems. Then you have the lack of systemic outcome assessment. You have the lack of resource evaluation, which is related to quality for specific diseases. You have persisting variations among providers. Different providers behave in different ways. You have few formal monitoring systems, like especially for coming to the Indian standards. I'm hearing that many of y'all are customizing stuffs. But if you have a vision for the future, if you think about interoperability, where the future lies, I'm really wondering, and I'm thinking about the challenges that we are going to face if you plan to only customize within your own setup, rather than thinking of having some standard product in place which can help in interoperability in the future. So what are the characteristics? It should be measurable. An indicator should be measurable. It can be quantified or measured, and it might be either qualitative or quantitative. So an example would be number of times an X incident happened. Comparable, it should be comparable. Number of times the rate of X compares to Y. We're talking about benchmarking here. Timely, and it should be achievable within a time frame. I'm sorry, the time constraint out here was not achieved. Okay, so it should have clear terms and should be easily understood, such that individuals and groups know their behaviors. Then it should be relevant to, consistent with specific organization, vision, strategies, objectives, goals, etc. It should be governed, accountability and responsibility. It should be defined, and it should be clearly understood who's going to be accountable, who's going to be responsible for this, and resourced. The program is cost effective. It should be, because when we are talking about countries which are just in the developing stage, and adequately resourced throughout its lifetime. So indicators are powerful tools. They are used for monitoring, communicating clinical information about the population health as well. So they are useful for supporting planning, for example, identifying priorities or targeting resources, and for tracking progress towards a broad community objective. Now, they help to engage partners into civic and collaborative action by helping to build the awareness of problems and trends. And in addition, they also help to inform policy and policy makers in particular that they can be used to promote accountability among governmental and non-governmental agencies. So we have different types of clinical indicators out here. A simple example is a rate-based indicator, clean and contaminated wound infection. You must have heard about this in the medical records very often. Now, these indicators, the rate-based indicators, basically they use data about events that are expected to occur in some amount of frequency. Then you have the sentinel indicators. What are the sentinel indicators? The sentinel indicators, they identify individuals individual events or phenomena that are intrinsically undesirable. For example, number of patients who died during surgery. These are due to, they are termed as sentinel indicators. Now, next you have structural indicators, which speak about, the proportion of medical staff undertaking a specific procedure who are accredited in accordance with a national standard. I'm just giving you the examples, not much stressing on the details, because I'll be going really very lengthy due to time constraints. Process indicators, on the other hand, they aim to measure the extent of the application. For example, management of care for people with diabetes and asthma. Next, you have outcome indicators. They speak about the rates of perinatal mortality, surgical mortality, and even cancer survivals. Generic indicators, we speak about proportion of specialists to other doctors, or registered patients in the emergency department for more than 6 hours. Then you have the disease-specific indicators that are diagnosis-specific, and they measure particular aspects of care which are related to diseases, for example. You have the proportion of cardiologists to other doctors treating patients with heart failure at the Department of Cardiology. So it's basically a peer-to-peer thought. Then types of care can be preventive, it can be acute, it can be chronic. And functions like screening, diagnosis, treatment, follow-ups, etc. And modality, it includes history, physical examinations, laboratory, etc. Now, this is a small case study which I've just placed on board to just inform you a little bit more on clinical indicators. We are looking at a lot of clinical documentation improvement which is happening in the UAE. That's the place where I stay. And clinical documentation improvement is, of course, the core of data. Now, with respect to clinical documentation improvement, the coders in the region are required to, when they are abstracting the codes, they need to read the charts properly to make sure that they don't miss out on certain clinical indicators which the physician may have not mentioned in the diagnosis. So now, speaking of this example, this is an elderly male who has been admitted with mets of lung cancer, and a pneumonectomy was done. So he's receiving radiotherapy for mets to the shoulder, and he's steadily declining, bedridden for 4 weeks. Other diagnoses were hypercalcemia, atrial fibrillation, dehydration, hypertension, and fecal impaction. So now, when we are looking at the diagnostics part, he complains of SOB, that is shortness of breath, And then his arterial blood gas levels, he's having a pH 7.53 with a PCO2 of 44.4 and O2 of 24 with an oxygen sat at 48%, and he has been put on oxygen. So now, what do you understand by this? I understand that you all don't know about the, I mean, you all must not be currently having the values of normal, the diagnostics. Now, when we talk about ABGs, that is the arterial blood gas levels, the pH levels between 7.35 to 7.45 is normally considered as a normal. So out here, what has happened? The ABG is 7.53. What does it mean? If it is higher than 7.45, the patient is alkalotic. And if it is lower than 7.35, the patient is acidic. A normal logic. So now, this patient, what does he have? No, I'm asking whether he is alkalotic or is he acidic? He is alkalotic. I saw your lips out there. It's okay, fine. He is alkalotic because his pH is 7.53, and if it is higher than 7.45, he is alkalotic. Now, normal range of BUN creatinine ratio is 10 to 20. We know that the normal BUN level is between the 7 and 20 range. And as kidney function decreases, the BUN level increases. Now, even speaking about creatinine, the blood in the blood, it's approximately 0.6 to 1.2 milligrams per deciliter in adult males, and 0.5 to 1.1 milligrams per deciliter in adult females. So now what has happened out here? The BUN is 45, which is well above the mark, and you have a creatinine of 2.9. So as you said, who was that? Yeah, as you said, it's predictive, a possibility that the patient has acute renal failure. Now, the next part, the ED doctor, he notes that he's ill-appearing, he's thin, cachectic, temporal wasting, and he decided not to treat at this time per dietary and physician-ordered diet per patient desires. Now, later in the admission, what happened? BP fell to 81.48. We know that 120 by 80 is the normal range. Now, the heart rate was 91. Again, there was a lot many BP evaluations which were done, 72 by 43, 60 by 36, etc. No treatment was given, but the BP was monitored frequently. Now, the physician out here has mentioned hypertension. Now, if the patient is hypertension, why is his BP low? So that is a clinical indicator that could be that the patient is hypotensive, or he might be having a protein calorie malnutrition. And lastly, on admission, his WBC count was 20.6. So absolute neutrophils is 17.8, where the limit is 1.7 to 6.7. So this could be an indicator that the patient most probably was having sepsis. So we'll talk about performance indicators out here, just rushing through the slides. The increased interest in measuring and reporting the quality of care basically has heightened the efforts to develop quality indicators. So we have performance indicators which measures whether the standard has been met. For monitoring performance, they are useful in establishing benchmarking, as well as they assist when comparing to performances. So we have KPIs as well, and most KPIs, they fall into the four categories. The main categories are revenue improvement, cost reduction, process cycle improvement, and increased customer satisfaction. So KPIs, we know, they can be used within the company or the department for tracking its goals and even determining or fine-tuning its core practices to achieve best results. I'll explain this slide with just an example out here. We have input indicators, process indicators, output indicators, outcome indicators, and efficiency indicators. And just one example. Let's say my business provides coffee for catered events. Some inputs would include the suppliers, the quality, the storage, etc. The water and the time in hours of employee costs. And that is what my business invests. My process measures could relate to coffee making procedures, or even the equipment efficiency, or even the consistency. Outputs would focus on the coffee itself, the taste, the temperature, strength, style, etc. And the efficiency would likely focus on customer satisfaction and sales. We have a couple of indicators, again, in the HIIM or the RCM field, which speaks about discharged, not final coded, and Mr. Sabu is looking at me, waiting for me to just clear off. So I'll just read out the, if anybody wants, you can just take the photographs and just Google it later for your research requirements. I don't want to spend that time for that. But one most important thing out here is to note the CMI, that is the case mix index. It speaks about how ill the patients are in the hospital. So if you know the case mix index of your hospital, you know what type of patients you are treating. So again, the CDI again has their own indicators in the RCM belt. We are again speaking about CMIs, review rates, query rates, response rates, quality and revenue impacts, etc. Sorry, I don't think I moved to the slide. Yeah. So this is something, I'm so sorry, I just brought the data which was available in 2017 because I just couldn't Google it out for the current data. But this was just a ranking to show you. In the UAE, we had, in the year 2007, it was road injuries, ischemic heart disease, stroke, etc. And in 2017, the ranking has gone to ischemic heart disease, road injuries, stroke, etc. Now, if you see the road injuries, it has gone to the second level, and the ischemic heart disease has gone to the first level. So what do we need to do as a community? We need to know how healthy our community is. Is our community in balance? What things affect health in our community? Are our programs and services or policies working? And are we moving towards or away from our vision of good health? The HIIM role, it's immense in terms of thinking about indicators. So the HIIM profession, it's basically gradually expanding into research and data statistics these days. We are talking more about health informatics, data analytics, etc. So HIIMs definitely contribute a lot to health care delivery these days. They manage the health information service, and that is the core to any kind of indicator that can prevail in terms of health. So, thankfully, we've reached the conclusion. The development of indicators. It's not an end merely to observe and document the spatial or temporal distribution of the things that are being measured. Rather, the reason indicators are used is to drive decision-making in health. The ultimate objective is to improve the health of the population, improving practices in healthcare, and to reduce unjust and preventable inequalities. So to summarize, indicators are not restricted for use only by managers. They are for everyone to use, every part of the population. And every single employee in a firm has goals to achieve, targets to meet. And so indicators can also be utilized at every level. You don't literally need to do this to identify indicators around you. Thank you.
Yeah, thank you, Anita, for the wonderful session. I know it is a very long topic to be discussed, but you have very interestingly put the indicators, health indicators, and the significance of health HIIM in managing the health indicators. As we are running short of time, I think we are not going into a question answer session. I think anybody having questions can meet her during the lunch time and can ask, because we have one more small talk has to be there. Uh, I think we are ending up this session.